this is Varsha Sharad and I'm a speech language pathologist at Lorem. We're going to see about stuttering in children today. So everyone has difficulties in speaking fluently. It's mostly because we're anxious or because we're not confident in a particular language. But in children with stuttering, it's mostly seen that the frequencies are more, the duration is more, and it interrupts their daily living. So in most cases, we can see that there's no particular cause for stuttering. It can be genetic. It can be because of a parental pressure. When there is a delay in speech, the parents start pressurizing the child to speak more correctly, communicate better, resulting in stuttering-like symptoms. And it can also be something related to a speech motor control deficit. There are several risk factors that has been quoted in several researches. The first one being their genetic. The second is if they're exposed to someone in their family who also has stuttering. All of these can result in stuttering-like symptoms for the children. So mostly what are the dysfluencies? The first one is repetition, where it can be a part word or a syllable repetition. The second is prolongation, when you prolong a particular sound or a word. The third is a block. And fourth is when we are using fillers when we speak, when we mostly say or we use a word, pause for a while. All of these things are seen in children. Mostly when we deal with the children and an assessment is done, we assess them in a natural environment to get maximum responses as possible so that we can profile their dysfluencies and note in which situations they have more incidents of stuttering. So the first thing a parent should notice when a child is stuttering is in which situations are they stuttering? When is the frequency increasing? So after noticing such things, you are referred to a speech language pathologist where an assessment is done, and further they are enrolled in a speech therapy. Most of these children when they are enrolled for speech therapy, their stuttering modification therapy is different from that of an adult. We use a fluency shaping method where children are using child-based therapeutic approaches. We make them more conscious about their breathing pattern, ask them to reduce the rate of speech rather than directly making them aware of their speech or when they are stuttering. So there are few tips that the parents can follow who have a child with stuttering. The first one is to slow down your rate of speech. The second is to patiently listen to the child and wait for them to complete the particular sentence. The third will be to make sure that when the child has some dysfluency in his or her speech, you repeat the particular word or a sentence without a dysfluency. In case any of your children are showing symptoms of stuttering, please do contact a speech language pathologist immediately. For any queries or questions regarding the same, please do post in the comment section. Thank you.